My name is Dr. Elie Ghanem. I recently joined UAB Hospital at Highlands approximately 3 years ago. I do mostly hip and knee replacements. I'm going to tell you a little bit about my practice. I do hip knee replacements, first-time surgery, partials, also replacements for the hip from the front of the hip, or called anterior approach if you're interested in that. We also do complex surgeries of hip and knee for the community, as well as patients being referred to from Tennessee, Georgia, and northern Florida as well. And so you're not alone in terms of having arthritis. A lot of folks, probably a good chunk of the population, has arthritis. It gets very debilitating. You can't really walk that much. You can't keep up with your family or friends. You can't do the activities that you like to do. And so a lot of people, probably now close to 60 million, maybe about 20 or 30% of the population is affected by arthritis, and it becomes very debilitating and to deal with. And so we're going to talk about joint replacement, as well as talk about same-day joint replacement, where you have the surgery in the morning and you go home in the afternoon. And we'll touch upon how the replacement is, and also other options, including injections, gel injections, cortisone, that you may be interested in. And so arthritis is, it happens slowly over time, over many years sometimes, and it causes pain. The joints become very stiff. The body tries to stiffen the joint up so you don't have any motion, and with no motion, there's no pain. So that's the body's way of getting rid of pain. So basically you don't move. And so we want to try to reverse that, prevent that from happening. And so simple tasks, for example, going up and down steps, kneeling, getting things off the ground become an issue. And so a normal knee looks like this. The white portion here is the cartilage, and so this is a normal, healthy knee, probably when you were about 20 years of age. There's no arthritis or any degeneration. As you get older, you get almost what looks like potholes inside the cartilage. The cartilage starts to break down, and the bone is exposed underneath, and this causes pain. And this is what people call bone on bone. So when the cartilage is lost, you start getting these massive potholes, and it starts causing the pain. Same thing with the hip itself. The hip is a ball in a socket, and so with the ball inside that socket, there's plenty of cartilage here. This is a healthy cartilage. There's no, it's not affected. There's no damage. And of course, when there is damage that occurs, you start losing the healthy cartilage, and it starts to show the bone exposed underneath. And so when you come to our office, we do a thorough exam on you. We also go through your medical history to see if there's any pertinent problems from heart, lung, any history of strokes or diabetes uncontrolled. And of course, we get x-rays of the hip, the knee, and sometimes even the back, because the back can sometimes generate quite a bit of pain. And so we look at the exam from range of motion, see how stiff you are, make sure the reflexes are good. Sometimes, again, the back can be a contributing factor to the pain that you're having, as well as making sure that your skin is healthy and good for if we want to do surgery. And so the x-rays, if you have an x-ray, and of course this is what is called bone on bone, if you look at it, the cartilage is completely gone as compared to the outside of the knee, and so the bone is touching the bone of the femur to the tibia. And so you get sometimes cysts, as well as bone spurs coming out. And you get a deformity. The legs many times bow inwards with the knee. Sometimes they do bow outwards in about 20% of the patients. And so this is a normal on the left-hand side, normal x-ray, what it looks like of possibly a 20-year-old patient. Good joint space between the two bones. This is the blank space in between, and the x-ray is equivalent to that of cartilage. And of course, on the right-hand side is when it turns into bone on bone. Same thing with a hip x-ray. The hip is a ball and socket. Good joint space between these two bones, usually about maybe a quarter of an inch of bone is usually present when the joint is healthy. And of course, it deteriorates, and you end up with bone on bone, large, massive little cysts up here, especially here as well. And so that can develop with time. The options vary from either surgery or non-surgical. Non-surgical, of course, you can use anti-inflammatories, Advil, Aleve, naproxen, your choice of pain pill, as long as you don't have any stomach or kidney issues, and as long as your primary care doctor says it's okay and it doesn't interact with other pills, medications you could be taking for other problems. Physical therapy can be sometimes helpful, as well as supplements, and including gel injections, as well as cortisone injections. That can buy you some time, possibly 3 to 4 months, and then you can have another set of injections if they help. If they don't help, then the next step is to do either a partial or full joint replacement. Partials are usually done for knees, and we'll talk about them as well. And many times it's done when the inside of the knee is burned out, bone on bone. And so, excuse me, and so we replace the inside of the knee only. The outside of the knee and underneath the kneecap is preserved. And so that is a partial replacement. If you ever hear that, it's just a portion of the knee is replaced, not all of it. And so, you know, getting down to the question, do you need a joint replacement? Well, it depends on everything. It depends on your medical status, the x-rays, how they're doing, how you're feeling, if you're having a severe pain that's debilitating, and is it the right time for you to do it? So you sit down with your provider, the surgeon, as well will interact with your primary care doctor to make sure you're medically healthy for the surgery, and then make a decision with all of us. And so the replaced hip replacement, it looks very similar to this. You'll have we call it a cup placed inside of the hip joint, and a little bit of a stem that goes inside the thigh bone as well. And this is what it looks like on x-ray. There's also a little ball that articulates inside and moves inside that socket. The replaced knee has very similar application. We don't remove, people think that we remove a good chunk of the knee and to cut all this off. Actually, we take off only about 1/4 of an inch or 1/2 an inch at most of bone, and then we replace it almost like a tooth filling cap, and we cement it in place. And of course, there's a plastic liner in between for the two metal pieces to move on. And so this is what it looks like on x-ray with a thigh bone and shin bone implant. And of course, inside, you can probably see the little halo of that plastic piece in between. We have at Highlands a very good nursing staff as well as physical therapists. They're located on 5 Main and 5 North. It is a floor that's dedicated for mostly orthopedic procedures. They are trained to take care of patients who have had hip and knee replacements. And of course, the recovery is going to differ from one individual to another. Some patients are a little bit more, have more musculoskeletal reserve, which means they have more muscle strength, more muscle reserve, and so they may recover a little bit faster. Most of the patients now, we can get them to go home on day one. A few patients may need a few extra days, especially if they have medical problems, heart failure, lung problems as well, that can slow them down a bit. But most of our patients are able to leave on day one. And so most patients achieve most of their goals and recovery by 6 weeks, up to 3 months. On average, it's about 2 months. But again, it may differ according to the patient. Expectations play a key role. So at the end of the 3 months, we expect you not to have pain or very, very minimal pain. You can return to your normal activities, keep up with friends and family. You can resume gym exercises. Usually I allow that around 4 weeks after surgery. You can go golfing, you can kneel on your knees, and you can practice, if you want to, back to yoga activities with, of course, some restrictions for hip replacements. So they don't dislocate. And of course, the yoga instructors know these restrictions and they can guide you along, but you can return to the gym, outdoor activities without restrictions. We have generated a same-day surgery program at Highlands, which means you have your surgery in the morning, you go home in the afternoon. We've collaborated with our colleagues in anesthesia, nursing, and physical therapy and case management to make it a very fine-tuned program. We're doing hip, mostly knees, but we've actually done our first hip recently, about a week or 2 weeks ago after it was approved through Medicare. And so we are now doing both hips and knees for same-day surgery. So there's definitely medical criteria. We don't want to do it on everyone. It is for a select group of patients that are healthy enough to undergo this procedure. And of course, we need the expertise of our nursing staff, physical therapy, and occupational therapy. So some of the exclusion criteria, so if these apply to you, then you may be excluded from same day, which means you would have your surgery, stay one night, and then go home the next day. But if you don't have heart problems, AFib, stents in your heart, COPD, blood clots, infections before, social support at home, if you're alone by yourself, no family or friends or anybody to help you out or to help you in the first week or so, then it may be a bit tough to do a same-day discharge. Definitely, we have very robust criteria for you to send you home. So you have to walk at least 150 feet, which would entail you walking inside the house in an unlimited fashion. Whatever you want to do inside the house, you can pretty much achieve if you're able to walk 150 feet. And so that's why then you would be safe for home. And that's our goal. And so you have to also urinate medically stable. We've done a great job in terms of with our colleagues in nursing as well as anesthesia to build this program. If you're interested, you can always contact us and at UAB at Highlands, and we can see you, evaluate you, and see if you qualify for the same-day surgery program. Thank you.